Good afternoon and welcome to the Assembly Committee on Commerce and Labor. Secretary, will you please take roll?
Assembly members Anderson, present. Carter, present. Cole, Hardy, Howdigi, Kasama, Miller, Monroe Moreno, O'Neill, Roth, Torres Fawcett, Yeager, Urick, Chair Marzola.
Here. Please mark members present once they arrive. Welcome everyone that is here with us in Carson City, those joining us in Las Vegas, and those tuning in over the internet. Today we will hear 4 bills: Assembly Bill 106, Assembly Bill 463, Assembly Bill 511, and Assembly Bill 513. I will not be taking those bills in order. We will also conduct a work session to take action on measures the committee has heard in previous meetings. Before we get started, I do have a few housekeeping announcements. Members of the public may provide testimony in various ways, all of which are listed on the agenda. If you have handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. Committee information is available on Nellis, which can be accessed through the legislature's website. You may also watch our meetings through Nellis or the legislature's YouTube channel. We ask that public comment be kept to 2 minutes so that everyone can be accommodated. I expect courtesy and respect in all our interactions, even if we may not agree. Lastly, if everyone can please check their electronic devices, especially your cell phones, make sure they are either off or on silent mode. And with that, we will move to our work session. It is not customary for the committee to take testimony or otherwise rehear the bills during a work session. However, I may invite a witness to come forward for clarification or questions during our consideration of a measure. We will start with Assembly Bill 52.
Assembly Bill 52 revises provisions relating to the payment of claims under policies of health insurance, sponsored on behalf of the Nevada Commission on Minority Affairs, heard on March 5th, and there are 5 proposed amendments on the bill page.
Thank you. Committee members, are there any questions on Assembly Bill 52? I don't see any. I'll entertain a motion to amend and do pass on Assembly Bill 52. I have a motion from Vice Chair Howdigi. Is there a second? Second. I have a second from Assembly Member Torres Fawcett. Is there any discussion on the motion? God bless you. I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I'll assign that floor statement to Vice Chair Howdigi. Thank you. Our next bill is Assembly Bill 116.
Assembly Bill 116 revises provisions relating to food delivery service platform providers, sponsored by Assemblymember Torres Fawcett, heard on February 17th, and the proposed amendments are on the bill page.
Thank you. Members, are there any questions? I don't see any. I'll entertain a motion to amend and do pass Assembly Bill 116. So moved. I have a first from Vice Chair Howdigi. Is there a second? I have a second from Assemblymember Cole. Is there any discussion on the motion? Assemblymember Hardy.
Thank you, Chair. I'm a yes on this bill. I am in hopes there might be some further work done on it so that there's some provisions or penalties that actually are imposed on the ghost kitchen and shutting them down. But I'm supportive of the bill as it is. Thank you.
Assemblymember Torres Fawcett.
Thank you. I did want to clarify that the amended language does include a penalty for an individual that has the ghost kitchen for $100 per order, and then it includes a penalty on the platform that has it for $500, I believe, per day after the first 10 days that it has been up, so that they have time to vet it.
Thank you. Is there any further discussion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I will assign that floor statement to Assemblymember Torres Fawcett. Our next Assembly Bill is 241.
Assembly Bill 241 revises provisions relating to housing, sponsored by Assemblymember Howdigi, heard on March 26th, and there are 2 proposed amendments.
Members, are there any questions on Assembly Bill 241? I don't see any. I'll entertain a motion to amend and do pass.
So moved. Oh, wait.
I'm like, So, okay, I'll entertain a motion to amend and do pass besides Vice Chair. I have a first from Assemblymember Anderson. Is there a second? I have a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I'll assign that floor statement to Vice Chair Howdiggy. Next is Assembly Bill 319.
Assembly Bill 319 makes revisions relating to providers of health care, sponsored by Assemblymember Orent Liquor, heard on March 17th, and there are 5 proposed amendments.
Thank you. Members, are there any questions on Assembly Bill 319? I don't see any. I will entertain a motion to amend and do pass.
So moved.
I have a first from Vice Chair Howdiggy. Is there a second? I have a second from Assemblymember Torres Fawcett. Is there any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I'll assign that floor statement to Assemblymember Orent Liquor. Our next bill is Assembly Bill 396.
Assembly Bill 396 revises provisions relating to housing, sponsored by Assemblymember Baucus, heard on March 26th, and there are 5 proposed amendments.
Thank you. Assembly members, are there any questions? I don't see any. I'll entertain a motion to amend and do pass Assembly Bill 396.
So moved.
I have a first from Vice Chair Howdiggy. Is there a second? I have a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Please raise your hands. Assemblymember O'Neill, Kasama, Urick, Cole, and Hardy. Motion carries. I'll assign that floor statement to Assemblymember Backus. Next is Assembly Bill 437.
Assembly Bill 437 provides for the establishment of the Fair Access to Insurance Requirements Plan, sponsored by Assemblymember Dickman, heard on April 7th, and there are 2 proposed amendments.
Thank you. Members, are there any questions? I don't see any. I'll entertain a motion to amend and do pass on Assembly Bill 437. I have a first from Vice Chair Howdiggy. Is there a second? Second. Thank you. I have a second from Assemblyman Carter. Are there any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. I have a nay from Assemblymember Kasama, Urick, Cole, and Hardy. Motion carries. I'll assign that floor statement to Assemblymember Dickman. And our last bill on work session is Assembly Bill 500.
Assembly Bill 500 provides for the licensure and regulation of payments banks, sponsored by Assemblymember Yeager, heard on April 7th, and there are no proposed amendments.
Thank you. Members, are there any questions on Assembly Bill 500? I don't see any. I'll entertain a motion to do pass.
So moved.
I have a first from Vice Chair Howdiggy. Is there a second? A second from Assemblymember Cole. Is there any discussion on the motion? Assemblymember Kasama.
Thank you, Chair. We're going to vote this out of committee, but we look forward to the bill sponsors and presenters. They have talked about an amendment, so we're looking forward to seeing that amendment and the work they're doing with the banks and the credit unions on that. Thank you.
Thank you. Is there any further discussion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I'll assign that floor statement to Assemblymember Cole. Thank you, members. That will conclude our work session for today. I will now open a hearing on Assembly Bill 463, which revises provisions relating to prior authorizations. Welcome, Assemblymember Backus. You may begin when you're ready.
Good afternoon, Chair Marzola and members of the Assembly Committee on Commerce and Labor. My name is Shay Backus, and I represent Assembly District 37. I'm happy to come before you and present Assembly Bill 463 this morning. This bill revises provisions relating to prior authorization for patient care. Today, I'm joined by Dr. Joseph Adishak, president of the Nevada State Medical Association, which was founded in 1875 and is the largest organization in Nevada representing physicians, medical school students, and residents. Dr. Adishak is a board-certified OBGYN physician in Las Vegas who is also board-certified in the subspecialty of maternal-fetal medicine, caring for high-risk pregnant women. I'm also joined by Emily Carroll, senior legislative attorney at the American Medical Association, which represents hundreds of thousands of physicians across the nation and is a direct partner of the medical associations like NSMA. Ms. Carroll's area of expertise in the AMA is prior authorization reform. I am also joined by NSMA's policy director, Jacqueline Nguyen. While Dr. Adishak is going to help with the bill presentation, Ms. Carroll and Ms. Nguyen are also here to assist with questions that the committee may have. While I'm sure everyone has a story surrounding challenges with prior authorization for medical treatment, I wanted to start this presentation off with 2 recent denials of medical treatment that are very personal to me to show blatant issues with medical pre-authorizations. Around this time last year, my mom and my stepmom were both treating for different medical conditions to which their doctors referred them each for an MRI. My mom was suffering from shooting pain from her jaw up through her cheek, and my stepmom was suffering from extreme abdominal pain. Both were left with the option of paying for an MRI with cash despite having insurance. My mom, continuing to suffer from the sharp pain, fortunately had another doctor appointment with a different doctor of a different specialty who referred my mom for an MRI, and it was finally approved. My mom's MRI showed that she was suffering from an infection in her jawbone that ultimately required surgery. My stepmom's extreme abdominal pain did not go away with the denial of an MRI. So she decided to pay cash because she had the financial resources to do so. After her MRI, her doctor contacted her to apprise her that she had a mass on her colon. Within a week, she was in surgery. I shared these 2 exemplars of denial of medical treatment through the broken prior authorization process with NSMA physicians because of my interest in addressing challenges patients are faced with prior authorization mandates. AB 463 is pulled from the American Medical Association's model bill being introduced in other states, as well as provisions pulled from other states that have already legislatively prohibited an insurer from requiring an insured to obtain prior authorization for certain medical care, including certain preventative care services. Chair Marzola, I would now like to turn the presentation over to Dr. Adishak, who is down in Las Vegas, for some comments, and then I will walk the committee through the bill.
Thank you so much. My name's Dr. Joseph Adishak. It's A-D-A-S-H-E-K. I am a high-risk pregnancy specialist. I'm also president of the Nevada State Medical Association. So prior authorization has really become the bane of our existence. And unfortunately, it's the bane of our patients' existence. It just causes significant delays in care, and it's just become this huge behemoth of something that we literally have to fight every single day for our patients. And I could understand it if there's like a medication that costs $200,000 a year, okay, I get that, all right. But I had a patient yesterday, diabetic patient in pregnancy, and I saw her and she stopped checking her sugars about a week earlier. And even though she's very brittle diabetic, I go, why'd you stop? She goes, I couldn't get test strips. I go, what do you mean test strips? Like the thing you prick your finger and put some blood on a little strip? She goes, yeah. I go, why? The insurance company denied it. They denied test strips, and I went to my diabetic counselor. I go, what's this? She goes, yeah, this, we have to get prior authorization every single time for test strips, okay? Like, does this make any sense to anybody? If I was an insurance company, I would love my patients who are diabetic to check their sugars so they're in good control. And especially in pregnancy, high sugars significantly increase the risk of birth defects during the first trimester. So you don't have a week or two to be really brittle and be really high before it can cause severe birth defects, spina bifida, brain defects, heart defects, and so forth. You got one chance in the first trimester to give good control. What happens? Oh no, we have to get prior authorization. How much can test strips cost? Doesn't cost that much. So if patients can afford it, they'll just go out and buy it themselves, even though they have insurance. Why? Because the insurance company wins. They save money because the patients are paying for it themselves. Or they can't afford it, they just don't check their sugars, or they check it less commonly during the day. And wow, it's so frustrating as someone who wants to help their patients get good care and only to find out that the authorization is denied. And I don't know, a lot of people think, if something's denied, we just pick up the phone, and call Fred over United or something. It's not that way. You have to get a time to fight this. You're supposed to talk to a peer-to-peer review. I'm lucky if I get to talk to a nurse who knows anything about OBGYN. Unbelievable. And so Section 19 of our bill addresses some of these really significant issues. I had a patient last week, severe nausea and vomiting in pregnancy, and I'm sure many of you there have been pregnant before, or their spouse has been pregnant before, and you just watch them keep throwing up over and over again. There's a medication out there that is only used for pregnant women with nausea and vomiting, okay? So I want to give that to this patient because she's just throwing up all over the time, all over the place, all the time. And we gave her this one medication, doesn't really work that great. I really want to give her the medication only for pregnancy, but I find out that it's denied 100% of the time, so you have to go and fight it. And you have to prove that the first medication you gave didn't work. So how do you prove that? Well, the patient, if they've gone to the emergency room in pregnancy and got IV fluids, that's how you prove that the medication didn't work. So ridiculous. Why would an insurance company make a patient have to go to the emergency room? I would think that would cost more money, not less money. Why does this happen? Well, it happens because they hope the patient will spend the $500 or whatever it is for this anti-nausea drug so they don't have to pay for it themselves. It's unbelievably egregious. It's become this huge thing that our life is just swallowed up by having to get prior authorization for things. And our poor pregnant patients who are like miserable or something bad's going on. Last week, I had a patient with severe postpartum depression. There's actually a new medication out in the last year that is made only for postpartum depression, okay? And it is expensive. Why? Because they take it for 2 weeks and they're really pretty much cured for postpartum depression. It's kind of a miracle drug. It is somewhat expensive, but with severe postpartum depression, you have to prove that the first antidepressant didn't work, which means you have to wait 2 or 3 weeks of someone with horrible depression before you're maybe allowed to give this other medication, and you have to fight for it. You have to talk to someone who's denied it, and your poor patient, and the husband's calling, she's just so depressed, she can't take care of the baby. She's just sitting there, and just crying all the time. I mean, how powerless as a doctor is this? And what happens? You have to fight it. There's this medication made for postpartum depression, and you have to prove the other medications didn't work, and you have to prove she's significantly depressed. How do you prove your poor patient is depressed? It's not like someone wants to take this medication because they have nothing better to do. Prior authorization has just become the bane of our existence. I would please ask for this committee to help vote for prior authorization reform. It means so much to our patients, to everyone else out there, the doctors. I want to thank the committee so much for indulging me and listening to me. Thank you.
Thank you so much, Dr. Adeshak. Chair Marzola, if it's okay with you, I would like to walk the committee through the bill, and I'm going to do a high-level overview. There was an amendment that I hope has been posted to Nellis. I also was able to circulate it to the committee members last night. It does delete many sections of the bill and trims back other portions. So sections 1 and section 1 to 23 pertain to changes set forth in Chapter 687B of the Nevada Revised Statutes governing contracts of insurance, while sections 33 to 54 pertain to changes set forth in Chapter 422 of the NRS, which pertain to Medicaid and Children's Health Insurance Program. Sections 3 through 15 and 35 through 41 provide definitions pertinent to the bill. Sections 18 and 47 address how long a prior authorization, once approved, remains valid, especially addressing timelines for patients who suffer from chronic conditions. Section 19 and 48 address a list of medical treatment that shall not require prior authorization, and that's the provision that was not necessarily pulled from the AMA. This came from other states, specifically Minnesota, wherein they've already approved specific lists of treatment that don't require prior authorization. Sections 20 and 49 address prior authorization for emergency services. Section 21, 22, and 51 set up a system for a provider exception. Section 23 and 52 provide that if the insurer violates the provisions of the Act when it comes to prior authorization, then the request shall be deemed approved. With respect to Section 31, I want to stress this portion had been deleted, but I want to put on the record, because I had been working with different interest groups, that it's the bill sponsor intent that AB 463 does not extend to self-funded public health trusts. The next section that I will next address pertains solely to Medicaid and the Children's Health Insurance Program. Section 44 sets forth requirements for the department to establish written procedures for obtaining prior authorization for medical and dental care. Section 45 provides a timeline for when prior authorization should be approved or denied. Section 46 addressed peer-to-peer discussion surrounding when there is an adverse decision. I'd like to thank Chair Marzola and members of the committee for your consideration on Assembly Bill 463. I ask for your support of this bill to unfortunately put in place legislation to stop the overuse of prior authorization that is truly causing patients real harm and having to unnecessarily suffer and pain. Thank you. We stand ready for questions.
Thank you, Assemblymember, for your presentation on Assembly Bill 463. We will start with committee questions. Committee members, are there any questions? Assemblymember Morris? Miller?
Thank you, Chair. I haven't met her yet. She may have served before my tenure, but I'm sure she was an excellent Assembly member at that. With that, I do appreciate you, Assembly member, bringing this forward. And my question is, and I think it goes without saying just where I personally stand when I hear issues like this of, especially knowing your family members, but still as well, we all experience this. My question would, because you brought up an MRI, and I know those could be more considered under the treatment umbrella, and maybe the doctor could answer this, because it's been recommended, a doctor saying, hey, next step is we need an MRI. Would this, by any chance, cover just precautionary measures, such as the insurance that I have requires me to get clearance and a recommendation for a mammogram every year? Yet I know I can go out to the van that's in the parking lot, give them cash, and do it as well. And so when it comes to, there used to be a time when so many of our required annual medical exams were automatically covered. No questions, no referrals, nothing needed for us. And now everything, as we hear, even down to test strips for diabetics, now need approval. Would this bill cover some of those issues?
It's so tempting. Thank you, Assemblymember Miller. Shea Backus for the record. I think the Morris may be the combo between Miller and Monroe Marino. Maybe throw in another M last name there. But with that, I did say Shea Backus for the record. I was taking a dive in because one really cool thing about Section 19, and I will also defer to our AMA expert as well as Dr. Adishak because this is more his area of specialty. But the really cool thing that I really liked under Section 19, subsection C is a list of evidence-based goods or services for preventative care that have in effect a grade A or B identified by the United States Preventative Service Task Force. And I went onto the task force website, and there are numerous lists of preventative care type treatment in here. And I was trying to look quickly because there was a breast cancer, but that was actually for medication used to reduce the risk of women at increased risk for breast cancer aged 35 or older. That basically, it recommends that the clinicians offer to prescribe risk-reducing medications such as, and they list these medications that are probably too complex for me to say on the record, to women who are at increased risk for breast cancer. So there is those exemplars under A and B, even though it's a one line in the bill, there's probably, I don't know, like 30 items listed, but I'll go up to Dr. Adishak because this is his specialty.
Thank you so much, Assemblymember Backus. Yes, so the United States Preventive Task Force comes out with recommendations for basically preventative care for things such as mammograms. And depending on the evidence, how much evidence there is, they either give a grade A or B. So obviously, everyone knows that mammograms helps prevent breast cancer. Now, of course, you don't do mammograms on an 18-year-old, but so the Preventative Task Force makes recommendations on when mammograms should start. And when, I'll just talk about women's health, when pap smears should start and how often they should be and so forth. Okay, if it's recommended by the task force, it's got an A or B grade, they've looked at all the evidence for it. We just think that then it should just be covered without fighting for it for our patients. It's just unnecessary weight for patients and for us. And then, of course, the work it takes to do that. And you know why they do it. So you will go across the street and pay cash for it, even though it's recommended. And this is why prior authorization has just become totally out of control in our life, in our practice. So again, mammograms, everyone knows, shown to help prevent breast cancer. It discusses what age it should start at, and if you have significant family history, when you should start. So this is why we chose that, because it's evidence-based. A lot of insurance companies say, oh, we do a prior auth because it helps prevent fraud and everything. Well, here we are right here. If it fits in this category, it's already been shown to work, and it will help prevent cancer and prevent costs. So why not do it? Thank you very much. Oh, Joseph Adishak, ADA-SHEK.
Thank you so much.
Great question, Assemblymember Miller. I got it right this time. Committee members, any additional questions? I don't see any, but I do have a quick question. On your amendment, page 3, section 19, where we talk about prior authorizations, and I see that you have taken out in needing any prior auths from sub A to F. So my question is this: the diabetic test strips, if you're a diabetic and you're not pregnant, but you have a history of being a diabetic, does the doctor still have to get pre-authorizations for those strips?
Thank you for the question, Chair Marzola. Shay Backus, for the record. I am going to go back to Dr. Adashak because this is like an area, I mean, this is a specific ask for him to be put in here just due to his frustration. But I just want to make sure. So section 19 is all of those. They're not being deleted. The only portion that was deleted out of there was for mental health conditions, just because it was a little broad and just working with other stakeholders. We narrowed that. But everything else would be listed therein. We added these 2 extra items just from discussions with physicians. So Dr. Adashak, I'll go back up to you because it sounds like more of a treatment issue with respect to general practice, those patients having diabetes, but the intent of section 19 would be, this would be something that would be included. But to answer your question more fully, I think he would be more appropriate.
And so maybe I can clarify my question. So if we are saying that now we will no longer need prior authorizations for prenatal care if a pregnant woman has diabetes, correct? Did I read that correct?
Thank you, Chair Marzola. I mean, that's kind of a broad statement. I feel like I'm being a lawyer in a deposition. Shay Backus, for the record. I think it's very narrowed to the prescription of diabetes test strips.
So, and that's what I meant. So the test strips. So now you're no longer going to need a prescription or a prior auth, right? So you're going to be able to just give a script for the strips and it's just automatically going to be approved. So why are we just limiting that to women that are pregnant instead of everyone that has diabetes?
I can answer this. Thank you, Chair. Shay Backus, for the record, we didn't narrowly limit it to pregnant women. It just has in here under G, it would follow, a health carrier shall not require prior authorization for prescription of diabetic test strips. I just think it's just important to see how Dr. Adashak, when he has women who are high risk pregnant, just how awful it is that he can't just prescribe test strips. And yeah, that's something affordable. I wanted to use the other grave example in my situation with respect to MRIs because those aren't affordable to anyone. I mean, I know in Las Vegas how much you can pay cash for an MRI and where you can get an MRI that is somewhat affordable, but it's still over $300. Most people don't have that knowledge or the funds. That's not okay that I know this when everybody in my family is well insured.
Thank you for that clarification. Doctor, did you want to add anything?
No, I just want to add that I give the example for pregnant women, but no, this came out of the NSMA, specifically other doctors who don't take care of pregnant women also brought this up as an issue that we felt was so unnecessary. So it's for anyone who's pregnant who needs test strips, you should be able to write a prescription and they can get their test strips covered.
Okay, thank you. Committee members, any additional questions? Assemblymember Kasama.
Thank you, Chair. My question is, I think that the bill is lengthy and the amendment, and just wanted for clarification. I think at one point I saw ambulance services were covered. Is that still true or is that deleted?
Thank you, Assemblymember Kasama. Shay Backus, for the record. And I don't know. I feel like that part may have been, it may be under the emergency service provision, which is included, but I now need to go back and look. So if you give me a moment, or if, I'm not sure if our AMA, Ms. Carroll may know, because she knows the ins and outs from the provision that was taken from the AMA model bill.
Thank you so much, Assemblymember. Originally, certainly emergency care in general, I believe was included as being exempted for prior authorization, which is actually the national standard, but the codification of that into this bill would be excellent. There was a provision, I believe it was section 20, and I am not sure if that is in the amended version, that would have removed prior authorization. That included emergency medical transportation, but I am not sure if that is in the version that is for consideration right now.
You can get back to me.
Or Shay Backus, for the record. I'm hearing behind me all the people that have helped me work on this say it should still be in there.
Thank you.
Committee members, any additional questions? I don't see any. So I'll give you a couple minutes or a couple seconds to move back. We'll move to testimony in support of Assembly Bill 463. Is there anyone in Carson City wishing to testify in support?
Elliot Mallon, for the record, on behalf of the Nevada Osteopathic Medical Association. We're the Association for Nevada's Osteopathic Doctors. We are in full support of this. We thank the sponsor of the bill working on this, and we believe that it will help patients. Thank you.
Good afternoon, Chair Marzola and members of this esteemed committee. Leah Cartwright, Leacartwright, here today on behalf of the Nevada Psychiatric Association. I do want to note that the Nevada Psychiatric Association is in support of the bill as introduced, also in full support of the bill as amended. I want to draw your attention really quick to the Executive Committee to Review the Deaths of Children. This committee I've been attending since 2016. In 2018, the Clark County Child Death Review Committee brought forward 2 cases of children who had died because their medications were not approved, right? They didn't get prior authorization. One of them was a child who died from suicide after being seen in the ER and then being prescribed medications and not receiving those medications. The other, similarly, a child seen in the ER for breathing difficulties, prescribed a rescue inhaler, and passed away. So I've been wanting to talk about prior authorization for a long time, and I'm so grateful to the Assembly member for bringing this bill forward and for NSMA for working on this. I also think this will be a great workforce development draw for doctors to come to our state. You know, if you don't have to worry about insurance companies telling you what care you can and cannot provide, that's a huge motivator to come and practice in our state. So I thank you for your consideration and urge its passage.
Good afternoon, members of the committee. Chair Marzola, Sasha Sutcliffe-Stevenson, SASHA, SUTCLIFFE-STEPHENSON, here for the Nevada Oncology Society. I won't reiterate the great points made during the presentation, but we are supportive of this bill as it puts additional tools back in the doctor's tool belt. Thank you.
Good afternoon, Chair Marzola. My name is Sarah Mercero Adler, actually, and I am here today on behalf of the Nevada section of the American College of Obstetricians and Gynecologists. So they would like to underscore the testimony of Dr. Adishak, also the references to the need to be able to access mammograms and other preventative care. We think the fact that Section 19 is rooted in evidence-based practices will save time and improve the health of the patients in Nevada. We also would like to underscore the comments made by our colleagues. Thank you very much.
Chair Marzola, members of the committee, Connor Kane, CONNORCAIN, testifying in support of Assembly Bill 463 on behalf of Comprehensive Cancer Centers of Nevada. We are the largest provider of cancer care in the state. We think this will really help our practice and more importantly, will really help our patients. I do also want to note that Dr. Adishak was our high-risk pregnancy doctor when we had twins who are going to be turning 3 in a few weeks. And he is a phenomenal doctor, and we appreciate him taking the time today to present this bill and support this important issue. Thank you.
Thank you for your testimony. Is there anyone else in Carson City wishing to testify in support? I don't see anyone. Is there anyone in Las Vegas wishing to testify in support? Doctor, can I ask you to move back while people testify, please? Thank you. Sir, you may begin when you're ready.
Hello, Dr. Jaeger, Jaeger, first name Jason, Jason. I would like to voice my support on behalf of Advanced Spine and Posture, a Nevada-based medical, physical therapy, and chiropractic group for AB 463. Thank you.
Thank you for your testimony. Is there anyone else in Las Vegas wishing to testify in support? Broadcast, is there anyone on the line?
If you would like to testify in support for Assembly Bill 463, please press *9 now. or raise hand in Zoom to join the queue.
Hello, can people hear me?
We can. Please remember to state and spell your name for the record.
Okay.
You may begin.
Very good. This is Howard Barron, B-A-R-O-N, pediatric gastroenterologist here in Las Vegas, and a past president of the Nevada State Medical Association. I would like to voice strong support for this bill, as in our specialty, we deal with tons and tons of prior authorization requests for biologic medications for children with Crohn's disease and ulcerative colitis. And we've had recent experiences that have delayed onset of treatment for literally months, requiring hospitalizations and children getting sicker and sicker waiting for their medication. So I'm strongly in support of this, and I hope the committee sees to pass it. Thank you.
Hello. My name is Dr. Zoltan Mari, last name Mari, M-A-R-I, first name Zoltan, Z-O-L-T-A-N. I am a neurologist working at the Cleveland Clinic Lou Rubo Center for Brain Health in Las Vegas, and I am voicing strong support for the bill 463 on behalf of Clark County Medical Society. I'm the current president of Clark County Medical Society. As a neurologist specializing in Parkinson's disease, we are faced with prior authorization requests for an FDA-approved diagnostic test, the DET scan, and I have experienced pushback and peer-to-peer calls in which insurance companies had no idea what this is, and this delays treatment because this is a confirmatory test for Parkinson's disease, and it's FDA approved. It's standard practice. Prior authorization delays treatment and doesn't add anything positive for the community and our patients. And I wanted to emphasize the lack of medical justification for such delays. Again, this is Dr. Marley, and that is the reason I support the Bill 463. Thank you.
Caller with the last three digits 616, please press *6 to unmute yourself and begin.
Can you guys hear me? This is Suji Reganti, S-U-J-I-I, last name is R-E-G-A-N-T-I. I'm a medical oncologist and Nevada State Medical Association past president. Thank you, Chair Marzella and members of the committee for allowing me to speak on behalf of AB 463. I strongly here to support AB 463. This bill is important to me and to all physicians across the state. However, it's vital to more than just physicians, but also our patients. My first concern is my cancer patients receiving care in timely fashion. This is a matter of life and death for them. Prior authorization slows down this process entirely. At the present time, there's a delay in care, which affects the outcome for the patient. Please support AB 463 to help our healthcare system in Nevada thrive. Thank you.
Hello, Chair Marzola and members of this committee. My name is Catherine Nielsen, C-A-T-H-E-R-I-N-E-N-I-E-L-S-E-N. Today I'm testifying on behalf of myself and my family. I am a parent of a young child with type 1 diabetes, and I strongly support AB 463. When my daughter was hospitalized, she was in a coma for a week, and her care team found the insulin that worked best for her. But once we left the hospital, the insurance wouldn't approve it. She had to try and fail other insulins first, even though we had already known what would work for her, and that delay in care put her health at risk. And Chair Marzola, you asked about the test strips, and yes, they also require prior authorization, but not just test strips for the blood. We're also talking about urine test strips for ketones, and Medicaid refuses to cover blood test strips for ketones, which are much more accurate. And in fact, nearly every part of her care does require a prior authorization, including the insulin, the test strips, her pump supplies. And if we make an adjustment to any of her dosages, we have to then start that process all over again. And it's exhausting, and it puts unnecessary stress on families managing a life-threatening condition every day and for the rest of her life, because she'll never outgrow it. And AB 463 would ease that burden. It would let doctors and families decide what's best, not insurance companies. Please help support this bill for our family and families alike. Thank you.
And thank you for your testimony. Broadcast, is there anyone else on the line?
Hi there. I am, good afternoon, Chair Marzola and members of the Assembly Commerce and Labor Committee. I'm Dr. Nehal Naik. I'm a board certified emergency physician. I serve patients throughout the Las Vegas Valley. Again, I'm here to support my AB 463. As an emergency physician, I experience issues related to prior authorization in different ways. I don't wait for insurers to approve my treatment in the emergency department for emergency care. That would be highly unethical. However, I frequently see patients who often turn to the emergency department for testing and diagnostics, or even initial management admission to the hospital due to denial of service by insurers. This bill could significantly save healthcare costs by reducing ED visits and hospital admissions, but by allowing patients to actually receive the care they need as an outpatient. I've had patients who come to the ED requesting radiology imaging, requesting CTs and MRIs due to persistent denials of insurance. Also, for example, as previously mentioned, for a pediatric gastroenterologist, my wife, also a gastroenterologist, attempted to initiate therapy for ulcerative colitis and had to deal with prior authorization delays, all while the patient's clinical course decompensated, ended up in my ED and required admission to the hospital. This bill could strongly reduce costs by reducing unnecessary ED visits and hospital admissions. I urge you to strongly support AB 463.
Chair, there are no additional callers to provide testimony at this time.
Thank you. We will move to testimony in opposition. Is there anyone here in Carson City wishing to testify in opposition of Assembly Bill 463? You may begin when you're ready.
Good afternoon, Chair Marzola and committee. For the record, Shelley Capurro, representing the Nevada Association of Health Plans, and we appreciate the opportunity to comment on why we're opposed to the bill. We recognize the importance of a balanced approach in ensuring access to care while maintaining affordability and prioritizing patient safety. We are concerned with the cost and patient safety implications of this bill. For instance, we have concerns with the blanket removal of prior authorization for certain services, such as outpatient mental health and substance use disorder treatment, cancer treatments, preventative care, and pediatric hospice care. These are complex areas of care that require careful review to ensure that the services provided are medically necessary and that they align with current clinical guidelines and individual patient needs. Removing prior authorization altogether for these services could lead to overutilization, unnecessary costs, and more importantly, delays in care if there is insufficient oversight to ensure that all treatments align with the most current standards of care. We look forward to continuing our conversations with the sponsor and the stakeholders, and we are going to work together to ensure the best for our patients and for our consumers. Thank you.
Thank you, Madam Chair. Members of the committee, Paul Young with Tom Clark Solutions on behalf of Farm School Care Management Association. PCMA is in opposition of AB 463 as originally drafted and amended. PCMA is concerned with the significant costs and care impacts this bill will have on consumers. The prior authorization process for prescription drugs aims to ensure appropriate and cost-effective treatment for consumers that works to reduce fraud and abuse, helps confirm that prescribed medications align with evidence-based guidelines, and promotes patient safety. Eliminating this process for a large number of healthcare treatment and services, including medications, will ultimately lead to the use of more expensive, non-formulary medications that will further drive up overall healthcare costs. Thank you, Madam Chair.
Is there anyone else in Carson City wishing to testify in opposition? I don't see anyone. Is there anyone in Las Vegas wishing to testify in opposition? Broadcast, is there anyone on the line?
If you would like to testify in opposition to Assembly Bill 463, please press star 9 now to join the queue. Chair, there are no callers choosing to testify at this time.
Thank you. We will move to neutral testimony. Is there anyone in Carson City wishing to testify in neutral of Assembly Bill 463? You may begin when you're ready.
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Division of Insurance. We did submit written testimony. I apologize. I did not get it in until this morning, so it's probably not available on Nellis yet. After reviewing the proposed amendment, I believe several of the items we have are moot and have been addressed. I did want to mention a couple items still. In Section 23 of the bill, that's the provision where a violation of NRS 687B.225 or Section 17 through 20 would require the authorization to be deemed approved. The division might request or suggest a little bit of clarifying language because as written, I think there could be confusion. It doesn't say, does the violation have to be adjudicated by a court, by an administrative hearing, or whatnot. And so a consumer might allege a violation has occurred, an insurer might allege that a violation has not occurred, and there could be confusion as to whether that statute and the deemer clause actually apply. In Section 57, subsection 2, with the effective date, it does say that contracts or policies of health insurance issued or renewed after January 1, 2026. We did provide written testimony. I highlighted and put in blue the wrong section, but what we wanted to bring to light is that it should probably say contracts or policies of health insurance issued or renewed on or after January 1st, 2026. Most individual market policies have an effective date of January 1. So if the effective date is left alone, so it just says after January 1, it won't hit those individual market policies until the following calendar year. And if there's any questions, I'd be happy to answer.
Thank you, Madam Chair. For the record, Ryan Beeman, B-E-A-M-A-N, representing the professional firefighters in Nevada. Just want to thank the bill sponsor for meeting with us multiple times to address our concerns with our self-funded nonprofit type plans that we administer, and appreciate that. Thank you.
Thank you, Chair Marzola and members of the committee. Ashley Kennedy, spelled K-E-N-N-E-D-Y, representing Clark County. I will ditto my colleague from the professional firefighters. We thank Assembly Member Bacchus for working with us. Thank you.
Yeah. Good afternoon, Chair, members of the committee. For the record, David Cherry, Government Affairs Manager for the City of Henderson. As a self-insured, we offer our employees a variety of healthcare services. We do appreciate as well the sponsor of the bill working with us and making the amendment clear that that we are no longer covered in the bill as self-insureds. Thank you.
Thank you. Is there anyone else in Carson City wishing to testify in neutral? Is there anyone in Las Vegas wishing to testify in neutral of Assembly Bill 463? Broadcast, is there anyone on the line?
Thank you, Chair. If you would like to testify in neutral for Assembly Bill 463, please press *9 to join the queue. Chair, we have no callers choosing to testify at this time.
Assembly Member, would you like to give any final remarks?
Thank you, Chair Marzola. Normally, I would waive closing remarks, but I can never leave a question unanswered. So I wanted to circle back with Assembly Member Kasama that it is in Section 20, subsection 1, and I looked at it and I just didn't see it, but that's where it's at when it comes to ambulance for emergency services. I do also just want to thank Dr. Adeshek for being here and participating. He did deliver a baby this morning at 5 a.m., but I'm getting blown up with text as I was sitting here presenting of other babies he delivered in the building, and I know he also recently delivered our majority leader in the Senate's baby just recently too. So a shout out to him to say thank you, and thank you for the committee to considering and hearing this bill, and I hope I can gain your support.
Thank you for being with us this afternoon. I will now close the hearing on Assembly Bill 463. I will now open the hearing on Assembly Bill 513. This measure revises provisions relating to chiropractic physician and chiropractic assistants. Mr. Musgrove, welcome.
I just put gum in my mouth. I apologize. Dan Musgrove for the record, representing Strategies 360 today on behalf of the Chiropractic Physicians Board of Nevada. The Chiropractic Board is existed in Nevada for over 100 years. We are one of the good actors, as those of you who may have served on the Sunset Subcommittee. We've always been very receptive to all of the suggestions and responsive to audits, and so we pride ourselves on working to bring in quality chiropractic physicians and assistants into the state to serve all of your constituents. So I'd like to introduce next to me Julie Sandberg. She is our executive director. Well, we are going to ask Dr. Jason Yeager, who took a break from serving patients today. He's in Las Vegas, and he will present the bill. He is our legislative chair, and we will get through this as quickly as we can. Thank you, Chair.
Thank you, Mr. Musgrove. Dr. Jason Yeager. Thank you, Chair Marzola, as well as the esteemed members of the Committee of Commerce and Labor. I appreciate you allowing me to be here today. We're here to present today on Assembly Bill 513, and what we'd like to go through is some of the highlights. The intention of this bill is a safety of protecting the members of Nevada or the residents of Nevada. We want to be able to provide better access and availability to chiropractic health care. So I'm going to start off with going through Section 1. Section 1 relates to the chiropractic assistant. We call this the CA. Section 1 of the bill allows for the chiropractic assistant to apply for a temporary certificate so they can work under the direct supervision of a licensed chiropractic physician. The board's intent is to create a quick, temporary licensure for CAs to cover for staff shortages. This would include important elements like illness, maternity, paternity leave, and vacations. Presently, the board can issue a time-limited temporary license for a chiropractic physician, but cannot do the same for a chiropractic assistant. Section 2 also relates to the chiropractic assistant, or the CA, and it enables Section 1. Section 3 is language that provides that one of the board members for the CBPN, that's the Chiropractic Physicians Board of Nevada, require that they serve the indigent or the underinsured. So Section 3 of this bill removes this membership requirement for a board member who represents the interest of persons or agencies to provide health care to patients that are indigent, uninsured, or unable to afford health care. It's frankly been difficult to find a member who will strictly fall under these services to serve the population. The total makeup of our board would remain the same and be unchanged, with 5 chiropractic physicians as well as 2 public members. Section 4 is related to the Doctor of Chiropractic examination, and really it's an on-demand provision. This again allows the potential licensed chiropractic physician to be able to be available and ready to serve the Nevada public quicker. This will allow for examinations that are currently held only semi-annually to also occur at other intervals as prescribed by the board. This will allow the chiropractic physician to be licensed quicker and allowing them to take the examination when they're ready, instead of waiting semi-annually without having to wait for this time period. Section 5 is an attestation for the jurisprudence, or better known as the law exam. Section 5 of the bill requires that an application for the examination submit to the board a statement that they attest that they've read the law, they understand, and they will abide by the provisions of existing law for NRS 634, 626, as well as NAC 634, are regulations governing chiropractic physicians and also the provisions of healthcare in Nevada. Section 7 and 10 of this bill eliminate the jurisprudence examination requirement. The real reason behind this is that our exam has been offered online for some time, and because it's an open book test, essentially it's become meaningless. We believe that an attestation will better serve the Nevada public and get qualified licensed chiropractic physicians, helping Nevadans faster. Section 8 is the chiropractic assistant, or CA, element of our bill. Section 8 of the bill removes the requirement to include at least 12 months of training or the equivalent to become certified as a chiropractic assistant. The language was really aspirational for there to be a chiropractic assistance program that would get developed with the high schools, the community college, or the private entities. However, this has proven challenging and it just hasn't happened. There currently is no pathway in the state of Nevada for such a program, and no program currently exists. Section 9 is the renewal of your license or your certificate on the birth month of the applicant. This is really designed to be a better system and a better ease on our staff as well as the licensees. The bill changes the renewal date for all licensees or registrants from January 1st of each year to the last day of the month in which the holder of the licensee of the certificate was born. Scheduling renewals based on birth month is more efficient, it distributes the workload, it reduces overload, and is strongly supported by our staff. Section 10 is an attestation to jurisprudence. This is for somebody that's previously held a license, but they've gone inactive. It requires the applicant, again, restating his or her license from inactive or expired to acknowledge that they read, understood, and they'll abide by NRS and NAC 634 and 629. This is similar to the language that we just mentioned for the new applicant. Section 11 of the bill is a cleanup language that strives to eliminate irrelevant fees, properly define the board when the board can charge for an application fee submitted by a course provider, as well as continuing education for dry needling. Section 13 of this bill contains more conforming language, as well as requiring that cease and desist orders must contain a mailing address, an email address, as well as a telephone number. And finally, sections 3, 5, 6, and 12 of this bill provide conforming language, pardon me, at the direction of the Chiropractic Council of Education, the CCE. This will include the words Doctor of Chiropractic Degree Program. This is going to broaden the pool of potential applicants to our great state of Nevada. This opens up applicants to apply from Europe, Australia, Asia, and the African continents. Thank you.
We're ready for questions, Madam Chair.
Thank you. Thank you, Dr. Yeager, for your presentation. Committee members, are there any questions? Assemblymember Urick.
Thank you, Chair. Thank you for the presentation. In my capacity as a workers' compensation attorney, I deal with a lot of chiropractors. And I sent out this bill to a number of them and asked for some feedback, and they all love it. So thank you for your hard work on this. There is one provision, though, that I will tell you 80% of them came back and said, can you please help us with this? And it comes in section 9, where we're moving the renewal period from a January 1 to the birth month. And I understand from Dr. Yeager's presentation that it's to address some of the administrative burdens when you're getting all these folks together at one time, having to process these. So when I push back on some of my providers that I spoke with, they said really a big portion of the burden is on them when they fill out all the information that goes through the online portal. They also expressed concern that the consistency of the way it is run now at the end of the year is super helpful for them in scheduling their continuing education requirements that allows a minimal disruption to their patient care. So while I understand and I'm sensitive to the concern of administrative burdens, in the name of keeping patient care a priority, and with 80% of my providers requesting that, I'm asking if you would consider keeping that portion of the bill at the January 1 renewal date.
Thank you, Assemblymember Urick. I appreciate your comments. Dr. Yeager, for the record, Jaeger. Those are excellent points, and they were deliberated quite heavily by our board when we discussed this. I don't think of all of the elements that we discussed today that this would be a big one to find a more common ground or even to remove. So I appreciate that feedback and comment, and certainly I'd be happy to hear from other licensees about how this would affect them positively or negatively.
Committee members, any other questions? I don't see any. Dr. Yeager, if you can step back just in case anybody wants to testify. We will hear testimony in support of Assembly Bill 513. Is there anyone here in Carson City wishing to testify in support? I don't see anyone. Is there anyone in Las Vegas wishing to testify in support of Assembly Bill 513? I don't see anyone. Broadcast, is there anyone on the line?
To testify in support of Assembly Bill 513, please press star 9 to take your place in the queue. Chair, we have no callers choosing to testify in support at this time.
Thank you. We will move to testimony in opposition of Assembly Bill 513. Is there anyone in Carson City wishing to testify in opposition? I don't see anyone. Is there anyone in Las Vegas wishing to testify in opposition? Broadcast, is there anyone on the line?
To testify in opposition to Assembly Bill 513, please press star 9 to take your place in the queue. Chair, we have no callers for opposition at this time.
Thank you. We will move to neutral testimony. Is there anyone in Carson City wishing to testify in neutral? I don't see anyone walking up. Is there anyone in Las Vegas? No one is walking up. Broadcast, is there anyone on the line?
To testify in neutral to Assembly Bill 513, please press star 9 to take your place in the queue. Chair, we have no callers for neutral.
Thank you. Dr. Yeager or Mr. Musgrove, would you guys like to give any final remarks?
Thank you, Madam Chair. Dan Musgrove. Just to be responsive to Mr. Urick's comments, we would be open to whatever the committee chooses to. We've talked about it in the last few seconds, and we're okay with whatever direction the committee chooses to go. And we would, knowing that Friday is the deadline, we'd love to see the bill move out. So anything that'll make this committee happy, we're willing to do. Oh, anything.
That leaves it really open. I will now close the hearing on Assembly Bill 513. I will now open a hearing on Assembly Bill 511, which revises provisions relating to insurance. Welcome back, Dr. Yeager. You may begin when you're ready.
Thank you very much, Chair Marzola. I appreciate coming before the committee today, and I'll go into a little bit more depth. Today, I'm here as my capacity as a Nevada chiropractic physician and licensee, and as a Nevada resident that's been here for 4 generations, and both of my children have grown up here as well. I am the CEO of a medical physical therapy and chiropractic group in Nevada, Advanced Spine and Posture. I'm a past board member for the Nevada Chiropractic Council and Association. These are the associations that represent the best for chiropractic in the state of Nevada. And thankfully, these 2 associations have just joined and merged and aligned, which I think is a great relief to the assembly members for chiropractors to have a unified voice. I'm also currently vice president for the National Board of Chiropractic Examiners. This is the postgraduate testing entity that, like any healthcare discipline or even law disciplines, after graduating from school, you have to prove safety and proficiency by taking board exams. And then finally, I'm the vice president and treasurer for the CVPN, the Chiropractic Physicians Board of Nevada. I list all these things to state that I'm not representing today on behalf of any of those entities. But again, where I started, which was the legislative chair for the Nevada Chiropractic Council and the association. In 1983, a law came on the books with the Division of Insurance, 689A and 689B. And when you look at the headers of both of these sections within the Division of Insurance, NRS, these are sections that govern insurance. What the rules stated back in 1983 is that a chiropractic physician shall be paid or reimbursed equally as other healthcare providers. But there was a nuance. The language said to the insured. And so fast forward recently in 2017, I had an opportunity and I was invited by the then chair of the Division of Insurance to testify about this. with what we thought would be a simple cleanup with the insurance companies. Really, what we're hoping for is that the insurance industry, which hadn't been consistent with 689A and 689B, we would have the Nevada Division of Insurance be able to help the insurers in Nevada to properly ensure that chiropractic providers, a very important part of healthcare in Nevada, receive proper payment and had proper coverage. As we went through the process in 2017, we were ultimately advised that since the law read that the reimbursement shall be made to the insured, the interpretation was that the payment would go to the Nevada resident, the person that has insurance, as opposed to a payment being issued for the services to the healthcare provider by the insurance company. So the proposed language, from our opinion, is a very simple cleanup. And as I understand it, there was a need and intent to clean up different healthcare license types throughout these NRS. So what we hope in coming before you today is that this makes sense, it's logical, it's a very simple language cleanup. When you look at the Affordable Care Act, the Affordable Care Act stated that it was critical that like healthcare providers be paid and not discriminated against equally. When you look at who is defined as a physician federally as well as in the state of Nevada, there's 6 physician types: medical doctor, doctor of osteopathic physician, a chiropractic physician, a dental physician, a podiatric physician, and an optometric physician. So those physician types, and when we look at the language in the Division of Insurance 689A and B, where within their scope of practice should be paid equally and give the important healthcare access to our Nevada residents. I'll pause there for questions.
Doctor, you can finish your entire presentation and then we will open up for questions.
Thank you, Chair Marzola. Dr. Yeager, for the record, Jaeger. I'm complete. I'm ready for questions. Thank you so much.
Thank you. Committee members, are there any questions? There are no questions, Dr. Yeager. You came on a perfect day. It is deadline week. But your presentation was also very thorough, so we appreciate that. And also your PowerPoint. Thank you very much. And with that, we will move to testimony in support of Assembly Bill 511. Is there anyone in Carson City wishing to testify in support? I don't see anyone. Is there anyone in Las Vegas wishing to testify in support? Broadcast, is there anyone on the line?
If you would like to testify in support of Assembly Bill 511, please press star 9 to join the queue. Chair, there are no callers choosing to testify at this time.
Thank you. We will move to testimony in opposition of Assembly Bill 511. Is there anyone in Carson City wishing to testify in opposition? I don't see anyone. Is there anyone in Las Vegas? Broadcast, is there anyone on the line?
If you would like to testify in opposition to Assembly Bill 511, please press star 9 now to join the queue. Chair, there are no callers choosing to provide testimony at this time.
Thank you. We'll move to testimony in neutral. Is there anyone in Carson City wishing to testify in neutral? I am getting you a nameplate. You may begin when you're ready.
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance, testifying neutral. We did submit written testimony. Again, apologies. I didn't get it in on time. I've been indisposed for the last few days. Did want to state that if you look at several of the provisions in question, many of them date from the late 70s into the early to mid 80s. Back then, indemnity health insurance plans were much more common, whereby a plan would just reimburse the consumer, the insured, a fixed amount for going to see a particular provider. So the language at the time made sense. These changes also make sense given the current situation of providers requesting reimbursements much more than consumers. Division has no issues with these changes. We'd be happy to answer any questions.
I don't believe we have any questions, but we appreciate your appearance every Monday, Wednesday, and Friday. Is there anyone else wishing to testify in neutral? I don't see anyone. Is there anyone in Las Vegas wishing to testify in neutral? Broadcast, is there anyone on the line?
If you would like to testify in neutral for Assembly Bill 511, please press star 9 now to join the queue. Chair, there are no callers choosing to testify at this time.
Thank you. Dr. Yeager, would you like to give any final remarks?
Thank you, Dr. Yeager, for the record, Jaeger, Chair Marzola, and esteemed members of Commerce and Labor. I'm very grateful for you allowing me to appear before you today. I appreciate the comments from the Division of Insurance, and it does appear at this point that this appears to be an appropriate 2025 simple language cleanup, and I look forward to seeing this pass quite easily. Everybody have a great day.
Thank you, and thank you for presenting today and being with us on a Friday afternoon. I will now close the hearing on Assembly Bill 511. 1 minute recess.
The committee will now come back to order. I will now open the hearing on Assembly Bill 106. Chair Marzola, when you are ready, and I believe, do you have a co-presenter in Las Vegas?
I do.
Okay, if the co-presenter could approach the witness table. Thank you. When you're ready, Chair Marzola, please begin.
Thank you. Thank you, Vice Chair Howdigui and members of the committee. For the record, I am Elaine Marzola, representing Assembly District 21. I am the sponsor of Assembly Bill 106, which ratifies the Occupational Therapy, or OT, Licensure Compact. Today, Matt Oliver, the Advocacy Chair of the Nevada Occupational Therapy Association, is in Las Vegas. Is he sitting? And also Carl Sims with the Council of State Governments, CSG, Center of Innovation. He is joining us via Zoom to make this presentation as well. Occupational therapy practitioners enable people of all ages to improve their ability to engage meaningfully with everyday life by supporting their efforts to live independently at home or return to work after illness, injury, or surgery. However, the healthcare industry is facing a shortage of OTs, a situation exacerbated by factors including an aging population, increased chronic conditions, and a growing awareness of rehabilitative services. In Nevada, the Board of Occupational Therapy reports that there are 1,400 OTs and 421 OT assistants. The OT Compact has many benefits for Nevada, including improving the access to OT practitioners, continuity of care of our citizens, and licensure portability for OTs and OTAs. The OT Compact preserves the regulatory authority of each compact member state to protect public health and safety through the existing state regulatory structure. Unlike national licensure initiatives that supersede state regulatory authority, interstate occupational licensure compacts allow a member state to continue to determine the requirements for licensure in that state, as well as to maintain the state's unique scope of practice for all members of a profession practicing in that state, whether through a state-issued license or through a compact privilege. Vice Chair, with your permission, I would like to now have Mr. Sims from CSG who will provide additional information about the interstate compact, and then next we can go to Mr. Oliver.
Mr. Sims, when you're ready, please just state and spell your name for the record.
Thank you, Vice Chair. Carl Sims, CarlSims, with the Council of State Governments. I do have a PowerPoint presentation here for my remarks. So hopefully everyone can see that. So I just want to cover a few basics regarding the compact on how it works and primarily be here for any questions the committee might have. So to first review a few basics with compacts. They're created through model legislation, and that is developed through a stakeholder-driven process that's really consensus-based. So it incorporates the viewpoints of the regulators and the profession involved across states to develop that legislation, because that legislation acts as the contract between states that facilitates the multi-state practice for those practitioners. The language in particular includes the requirements for a state in order for them to join, as well as the practitioner within those states to use the compact. So for licensure compacts, they're a complementary voluntary pathway for practitioners to use by establishing those uniform criteria across states. And because there's that uniform criteria and standards, it really helps reduce what states are experiencing, reduced of the time and costs that would otherwise be needed to navigate different policies for multi-state practice. So another key benefit for licensure compacts is it not only benefits those practitioners wishing to come into a state, but also those current practitioners within a state that are licensed for them to provide likewise services across state lines. So think of cases of continuity of care. For example, if a Nevada resident were to temporarily relocate to another state, their practitioner within Nevada could still provide services through the compact. And then lastly, there's some other efficiencies to really point out here from the administrative side, whereas otherwise, if someone has licenses in multiple states, they have to track different continuing education requirements as well as different renewal cycles. The compact helps streamline that as well. Here's a quick visual about how the process works. So a practitioner who is residing and is licensed with that compact member state will be able to use the compact using that existing license. So this is an application process. They go through the Compact Commission's website. But again, that criteria is defined within the compact. So their ability to qualify for one compact member state will look pretty identical across different states. The only real difference there is if a state requires a jurisprudence exam, that's an option for states, then they can impose that requirement for a practitioner. But assuming they meet the qualifications, which I have a couple more slides to finish this up to detail those, they would go through that process of applying. It's a quick process because there's information already provided by the compact member states to verify the eligibility of those that they have granted a license for. So because of that uniform criteria and states agreeing through legislation, it provides that ability for that quick issuance of that privilege to practice and allow that practitioner to practice in other compact member states. They would have to apply for a privilege in each compact member state they want to provide services in, so they're able to really adjust for their needs of providing services across states. So for state eligibility to join, just a few things to point out here. States have to license occupational therapists and occupational therapy assistants. They have to have certain requirements in place for licensure, including utilizing a recognized national exam, as well as continuing education requirements. And they have to have a background check in place for anyone who's wishing to use the compact. For practitioners, just because they are licensed in a compact member state, reside there, doesn't necessarily mean that they will instantly have access to compact. They still have to meet some requirements, so that includes holding an active unencumbered license. If there is an encumbrance on their license, and that has to be at least 2 years since that encumbrance is lifted before they're able to use the compact, and they have to go through that background check and meet any jurisprudence exam that the state might require. I'll finish up by just showing a map currently showing where the different states are at with the OT compact. So you'll see the states here in the darker shade of blue are current compact members, and then those in the lighter shade, including Nevada, that are currently considering compact legislation. So by the numbers, there are 32 member states and then 9 currently considering the compact. The compact isn't yet operational. They're still developing the data system to make the function of the compact work, but we're expecting to go live for that to occur in August of this year. So that concludes my remarks here. Again, I will be glad to answer any questions the committee might have. And I know Matt Oliver also has some comments and testimony as well.
Yeah, thank you, Carl. For the record, Matt Olivier, OLIVIER, Advocacy Chair of the Nevada Occupational Therapy Association. We appreciate Chair Marzola's support and the opportunity to speak to the impact and benefits of a bill like this, and hello, committee. Today, representing this organization and the current OTP workforce highlighted on this slide. I'm here to urge support of AB 106, which would allow Nevada to join the OT Interstate Compact, which we got to just hear a little bit about, and discuss the opportunity to expand access through licensure mobility. Nevada currently has 1,789 actively licensed OTPs. While these numbers reflect a dedicated workforce, they are not enough to meet the growing demand for services. As someone who works in multiple sites, I can anecdotally attest to everyone is trying to hire OTs right now. By entering the OT Compact, Nevada can diminish this acute provider shortage, one that is well documented across the nation, and attract more practitioners to this state, reduce barriers to care, and align with the state's goals to improve healthcare for our populace, especially by addressing even greater provider shortages and concerns in our northern and rural areas. So moving ahead, the OT Compact isn't just about convenience, it's about closing critical gaps in care. We invite the committee to consider what this means for patient access. Patients, especially in those underserved areas, will benefit from more timely care, whether in person or via telehealth. Opportunity for border state collaboration. So as we saw on the map with Utah and Arizona already in the compact and Oregon working like us to join, Nevada's participation ensures seamless care for residents who live in or near state lines. The compact supports licensure mobility for military spouses, a key healthcare workforce demographic in our state. I've myself hired military spouses in my tenure as a director of rehab up in Reno, so we definitely lean on them. And this enables Nevada to modernize and meet the moment in national healthcare trends. This effort also aligns with the 2025 session initiatives that this committee has already heard regarding testimony for the PT and speech therapy national compacts as well. So alongside our PT and ST rehab partners in the state, we at NOTA view the OT Compact as a pragmatic solution to real change. And then next up, we want to look at things in terms of the OT work pipeline. So Nevada only has 4 OT training programs, 3 entry-level OTD doctoral programs, Toro, UNLV, and Hawaii Pacific University, and only 1 OTA assistant program at Pima Medical Institute. This inherently is a barrier because all 4 programs are housed in Clark County. And compounding on this, Toro has announced that they'll be closing down their OT program in 2025. So with fewer programs and none outside of Clark County, we must not only retain graduates, but also work to attract out-of-state talent. So right now, Nevada risks losing professionals to the compact states where licensure mobility is easier. Joining the compact makes Nevada more competitive. It signals to OTs nationwide that our state values their skills and reduces red tape to allow them to practice here. AB 106 isn't just policy, it's a win for Nevada healthcare's future. Licensure mobility means faster care for patients, reducing wait times that we see in a lot of clinics for rehabilitation and mental health services, which OTs provide. A stronger workforce joining 32 other states already in a proven system that's moving forward, and a healthier community across Nevada. So we urge your yes vote on AB 106 to prioritize patients, empower practitioners, and align Nevada with national best practice. Thank you for the time and consideration.
Vice Chair, if you would like, I can go through the bill for you. If not, we can stand for questions.
I think the committee is very familiar with compact bills and how similar they all are, so I will spare you walking us through the bill, Chair Marzola, and we can go straight to questions. Committee members, any questions for our presenter? We will start with Assemblymember Cole.
Thank you, Chair, Vice Chair. Thank you for bringing another compact bill. So my question is, and it's possible this is exactly the same as all the other compact bills when it comes to the rulemaking section, which is Section 10. But I don't recall it being the same. So forgive me if I'm missing something. But it seems like this section is very different in how we do rulemaking here with our legislative commission that has a standpoint in there. And the public hearing is only if it happens for 25 persons or an organization that represents 25 persons or more asks for a hearing on a rule. But I mean, we have a very definite process. So I didn't know if you know anything about that. Thank you.
Thank you for the question, Vice Chair Lee Marzola. For the record, if I can phone a friend and ask Mr. Sims.
Yes, thank you for so I can tell you that the occupational therapy rules section here, it is largely similar to other legislature compacts. So while they all have a lot of similarities, there are a few nuanced differences here. But that provision that you were speaking to in general, I think is found in a few other legislature compacts. But just to kind of broadly discuss about how the rulemaking works, that is for the Compact Commission. They have that rulemaking authority, and the Compact Commission is comprised of the compact member states. The rules that they're able to issue are narrowly confined to the administration of the compact. So, for example, they could never issue a rule regarding things like scope of practice, but they can issue a rule for things like what are the exact data set requirements for that member state to submit to the data system. So, so I can be glad to answer any other questions regarding the rules in particular, but it is largely similar to other legislature compacts.
Any follow-up, Assemblymember Cole?
And maybe it's for our legal policy folks to just say that it's fine. It's just the commission. It doesn't affect anything that we do here with our scope of practice, but it sounds like that's correct. Thank you.
Okay, I'll turn it over to our legal counsel, Mr. Quast.
Thank you, Madam Vice Chair, Sam Quast, Committee Counsel. That's correct. It only affects the commission and would not affect the rulemaking process of the board in this state.
Thank you, members. Any other questions? Okay, seeing none, I will now open it up to testimony in support. We will start in Carson City, then head to Las Vegas. Those wishing to testify in support, please approach the witness table.
Hi, and good afternoon, Vice Chair and members of the committee. For the record, Trevor Parrish with the Vegas Chamber. The Chamber is in support of AB 106, as the Occupational Therapy Licensure Compact will help Nevada continue to build a talented workforce for this vital healthcare sector. The Chamber would like to thank the bill sponsor for bringing this forward, and we thank the committee for your time and consideration. Thanks.
Good afternoon, Vice Chair and members of the committee. Areli Alarcon, spelled Areli Alarcon, here on behalf of Touro University, Nevada, the largest medical school in the entire state, here in support of AB 106. Thank you.
Okay, we will move to Las Vegas. Is there anyone wishing to testify in support? Please approach the witness table. Seeing none, AVH, can we check the telephone line?
To testify in support for Assembly Bill 106, please press star 9 to take your place in the queue.
Hello, my name is Casey Melvin. I'm the CEO of a multidisciplinary practice and a licensed occupational therapist. I strongly support AB 106, which would allow Nevada to join the OT Licensure Compact. Occupational therapists and occupational therapy assistants are essential in supporting individuals across their lifespan by promoting health, independence, and well-being. However, workforce shortages and administrative barriers limit access to these critical services, particularly in the rural and underserved areas, which is approximately 87% of our state. By adopting AB 106, Nevada will increase workforce mobility, expand access to care, and strengthen the economy. The OT Compact, paired with the Speech and Physical Therapy Compact, provides a state-driven solution that maintains strong public safety protections and state oversight while addressing the severe workforce shortages and lowering costs. I urge our legislators to support AB 106 and ensure Nevadans receive the medically necessary therapy services they need to live healthier and more independent lives. Thank you.
Thank you for your testimony, AVH. Next caller, please.
Hello, Chair and members of this committee. My name is Catherine Nielsen, Nielsen, and this testimony is in my position as the Executive Director of the Nevada Governor's Council on Developmental Disabilities. And to save you all some time, we will ditto all of the comments from Casey that just spoke. And I just wanted to add to that we are seeing occupational therapists leave the workforce at an alarming rate. And this shortage creates real gaps in care, especially for individuals with disabilities, those recovering from illnesses or injuries, and children in need of developmental services, and others that also benefit from occupational therapy. AB 106 is a proactive step to help fill those gaps, and we are excited to see this measure on the docket. Thank you so much for your support.
Thank you for your testimony. AVH, next caller, please.
Good afternoon. My name is Bree Melvin, Melvin, and I am testifying in support of AB 106. I work with a multidisciplinary practice that would greatly benefit from this bill because it would strengthen our ability to recruit clinicians to help the needs of our community. Thank you.
Thank you for your testimony. AVH, are there any other callers?
If you have recently joined and would like to testify in support of Assembly Bill 106, please press star 9 to take your place in the queue.
Hello, this is Dr. Yvonne Randall, YVONNERANDALL. I speak in support of AB 106 as a longtime educator of occupational therapy practitioners in the state of Nevada, being able to support the profession, but also support the needs of individuals who require the services of occupational therapy practitioners is really quite important. So as an occupational therapy practitioner, we do need to have accessible services around the state, not just in the Reno, Carson area and Las Vegas. Thank you for your support.
Thank you for your testimony. AVH, next caller.
Chair, the public lines are open and working. We have no more callers for support.
Thank you. We will now go to opposition. Is there anyone in Carson City wishing to testify in opposition? Seeing none, we will move to Las Vegas. Is there anyone wishing to testify in opposition? Seeing none, AVH, can we check the telephone line?
Chair, we have no callers for opposition at this time.
Thank you, AVH. We will now go to neutral. Is there anyone in Carson City wishing to testify in neutral? Seeing none, is there anyone in Las Vegas wishing to testify in neutral? Seeing none, AVH, can we check the telephone line?
Chair, we have no callers for neutral.
Thank you. I will now close the hearing on Assembly Bill 106. Committee, 1-minute recess.
Committee will come back to order. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes per person. Please remember to state and spell your name for the record. Is there anyone here in Carson City wishing to provide public comment? I don't see anyone. Is there anyone? I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
If you would like to provide public comment, please press star 9 to take your place in the queue. Chair, we have no callers choosing to give public comment at this time.
Thank you. That concludes our meeting for today. This meeting's adjourned.